Rick, good to see you again.
Good to see you here in the studio.
Another episode of Sugar Crush, and now the rest of the story. And I see you got the blink frames on.
I do. I love these things. These are just the bomb for
Do you
sure.
think your pickleball would be better with
I
those?
think it'll help with the dink shots.
Oh, yeah. Blink and dink. That's what we're looking at. Well, our today's guest is a phenomenal person to begin with a phenomenal company that's going to solve the ocular pathology world. And I'm blown away by the statistics. And I was just looking at that article from Apple News. 90% of the people in China have myopia. That's unbelievable. First, we send the colonel with the chicken, and we defeat them with our diabetes. Now we understand they can't even see.
That was pretty fun. We got some balloons going on.
Yeah.
Here. So we have in the studio here through Zoom, Joshua Park with Blink Frames, founder out of California. Welcome to Sugar Crush, Josh.
Wow. Josh, you were phenomenal. And so we met over in Newport Beach and then again in Las Vegas at the what is that?
A4M.
A4M, or is that? Do you know what that acronym is, Josh?
Advanced
Alternative Investment Forum.
Yeah, there you go.
Something?
Yeah, but there was a lot of people there.
Yeah.
The interest in alternative medical devices is phenomenal, and you got the number one device from your recent ophthalmology group.
Yeah.
So.
Yeah.
So we're looking forward to talk about that, and thanks for being on the show, and you'll hear the rest of the story.
Welcome to the show here, Josh.
Thanks, Dan. I really appreciate it. And Dr. Jacoby, it's great to see you again as well.
So I met Josh here, several months back at a med tech conference in Newport Beach at the Hyatt there. You had one of the best presentations, obviously one of the coolest. Definitely, there's a cool factor of your glasses that you put on. Of course, Rick spoke at that as well and mentioned you in his speech. So we're just delighted to have you on. I'm excited to be a part of on the capital raising side of the company here to tell investors what the opportunity is. You'll hear the story here from Josh, how he got started. So I'll just let you kick it off, Joshua Park.
Yeah, appreciate it, Dan. So as you said, I'm the CEO of Blink Frames, and we're building an ocular healthcare platform into a pair of glasses. And so back in 2019, we were meeting with what is now our medical advisory board and trying to figure out, okay, what's the biggest issues that they're seeing in the optometry and ophthalmology field? And what they said to us is they said, Josh, we just really don't know what's happening to our patients when they leave the office. We have a lot of different treatment plans. We have a lot of different medication we can put them on. But if we don't know what's happening to them, we don't know how to treat them. And so for 364 days, the patient can leave and the doctor's just hoping that they're getting better, that they're following their treatment plan, that it's even working. And a lot of times it's not. And so they come back a year later and they've lost another year of their vision. So for us, that wasn't good enough. We said, okay, well, we need to provide a solution for these doctors so that they can really tailor their treatment, monitoring their patient outside of the office. So we looked at different ways to do this, and eventually we came up with what I'm now wearing, which is a pair of glasses that have Wi-Fi, Bluetooth, temperature, humidity sensors, tons of different electronics and cameras embedded inside of them. They take 5,000 images of your eye every single day of the ocular surface. So we're looking in, not out. And with all that data, then we send that off to our servers and we process all of that data. And then we can help the doctor understand the longitudinal data, the long-term data. So we're not just looking at a single moment in time now in the doctor's office. Now we're looking at days, weeks, months, and years. And those kinds of trends can really help a doctor understand how to tailor treatment to each individual patient, not just a broad stroke, okay, Incredible. This is what you should do if you have glaucoma.
Mm-hmm.
So that's what we've been working on. And we have about 30 different diseases that we can monitor by looking at the front of the eye. So it's not just ocular, even though you would think, well, you're just looking at the eye, but things like neurological diseases show up in the eye, cardiovascular, general wellness, They all show up in the eye. It really is the window to your health. And so we're building this platform to look at it and monitor it and really benefit the patient and the doctor experience.
Josh, this is amazing. We just had coffee with some investors this morning, and they were drinking coffee. Of course, they put God knows what in it. And this one fellow, he was a diabetic, and I said, this product that you have measures in real time and follows ocular health. And he said, well, I have an ophthalmologist. I go to him once a year, and I said, well, you're the guy that needs these glasses.
And he's type 2
So
diabetic.
He's a type 2 diabetic. His sugar was 6.5. He had a load of sugar in his glass in front of him. I said, the A1C is a average over the last 3 months, but it spikes to get that average. And when it spikes, plus trauma, and you have myopia, and you can detach that retina. So there's lots. I said, but you're going to wait 365 days to see that doctor. This is real time. So then he got it.
He did. He was like light bulb moment. He goes,
oh my God, yes. So I had just happened to have your glasses with me, of course. And I took them out, and I took my glasses off and put your glasses on. And of course, I used the famous phrase, do you see what I see? And the answer, of course, no, because you can't see unless you have these blink frames on with a special camera to see what's going on in real-time data. Yeah. And as I was talking to him, I was thinking that's really important for not only ocular, but just general health and wellness, because you're recording exactly when that sugar spikes your insulin. You're going to have a change instantaneously. And you can look back and say that glass of coffee with sugar is causing inflammation in the eye in real time. So I thought that was a kind of a interesting conversation. But, you know, I'm going to lead this conversation to this device you have is so timely.
And they're good looking, too. I mean, I put these on, my IQ goes up like 30. They kind of match my, they bring out your blue in your eyes. So.
Yeah.
That's fantastic.
Yeah, he looks 10 years younger.
Very hard to make our friends. We don't want this to be a gimmick, right?
Right.
You can't play around with ocular health. Come on. Like, it's the 21st century. Let's start doing something to really benefit our patients. So we don't want, another $10,000 device that sits on the doctor's table that you use once a year. That's not beneficial to the patient. Like, there's enough of those. Other companies can handle that market. Well, we want something that's really going to impact the daily life of the individuals that wear our frames. And we need to stop as an industry, and as an ocular industry, need to stop focusing on diseases in a silo, right? We treat a disease like it's the only thing affecting the body, yet the entire health of the human being is really playing into the health of the eye, the health of the body, the health of the brain. So all of these things matter. And so we can't just focus on glaucoma or myopia or A1C, right? We need to look at all of them at the same time to understand what's happening to the patient, right? That's holistic patient health, not just let's just look at your glaucoma. Let's not worry that you're diabetic. Let's not worry that you're sedentary. No, we have to look at all of these things. Right. And when you get the data in, you really start to see what's happening. You see a greater picture of the actual human being sitting in front of you.
Josh, did you see that article? Let's discuss that, because I just brought it up again today to look at the Apple.
The Wire article, yeah.
So what's amazing, I don't know if you know this, but in another life, I was asked by the Surgeon General of Taiwan to go there to understand why they were getting diabetes in 1981. Okay, right. That was a few years ago. So I was there, and on and off for 3 years, I built their foot and ankle clinic for them, did a lot of surgeries, looked at diabetics. I didn't see that many diabetics, though. But they asked me to go around the country. So I was based in Taipei. So would I go to Taichung, And I went to that city, which was about 3 hours from Taipei. And this article in Apple News, that's where it's from, Taichung. And
Yeah.
but I'm going to ask you this question. It says in China that around 90% of the patients are going to have myopia. Is that correct? 90%?
Yeah. Yeah, it's some scary statistics. So we go to a lot of conferences, American Academy of Ophthalmology, and it's the big topic that's coming out right now. And it's a big impact. It was already swinging this way, that kids in general were developing myopia at higher and higher rates each year. But then COVID really solidified it, and it changed this kind of linear curve to more of an exponential. And it's some really scary data that's coming out. 50% of kids leaving elementary school are going to have myopia.
That's unbelievable.
Even in the U.S., right? Like that's crazy.
Can your company scale up that quickly to take care of the world's ocular needs?
So we believe so. We think that it's a huge issue that's coming about, and we really want to be, that tip of the spear that's attacking this, because children's health should really not be something that we mess around with, right? We should be devoting the time and energy to keep these kids from losing their vision. And so we've originally, our technology was not going to be pediatric focused. We were going straight to the adult market. And about a year ago, we started seeing these numbers come out as lockdowns were coming out, and you're getting this data and saying, oh my gosh, all of these kids are starting to develop myopia at younger and younger rates and at higher and higher percentages. And so we said, well, we got to do something about that. So we actually developed over the last year a pediatric line of our frames specifically targeting myopia. So looking at, like the article says, outdoor time, computer vision. How much time are you spending in front of a screen? How much time are you spending outdoors? How much UV light exposure are you being exposed to throughout the day? It's a really important thing because when you're developing as a child, the UV light is actually good for you. We think as adults, we're like, well, UV light's really bad, right? Skin cancer, cataracts. And that is true, right? There is issues there with ultraviolet light. But as a kid, there's some reactions that you really need to take place. So when you're exposed to UV light as a child, there's a dopamine response in your retina that actually slows down what we call axial length, the length of your eye. It slows down that progression and that growth. And you need enough UV light to actually regulate your eye growth as a child.
Wow.
And that kind of solidifies, around the ages of 10 to 12. So if you don't get enough UV light exposure before you're 10, you're probably going to develop severe myopia. And it's completely, nothing is completely preventable, but it is very much preventable from being severe myopia with the amount of medication and the amount of knowledge that we know of how to treat this disease.
Josh,
so the idea is,
would you just find that for our audience? What is myopia? My understanding, the eye is round and it becomes elongated, multiple different forces. The focal point gets in front of the eye, and so it starts to elongate it. And the other question is the effect on the ocular motor function, the motor components around the eye, because they're pulling at different vectors and causing an additional problem from the biochemical sugar issue. So you have mechanics plus sugar equals myopia. So
and so this is where a lot of my research was is in what we call ocular biomechanics. So that's my degree's in biomedical engineering. That's what we focus on. And what happens, so myopia is also just called nearsightedness, right? And so a lot of it happens when you're often stuck in front of something too close. So children have this a lot, right? And parents are worried about how much screen time you're having. And they should be worried because that screen time doesn't force your eyes to stretch in the correct way. And so they get lazy And then they actually want to just expand in one direction and not necessarily grow in the correct way. So myopia, nearsightedness, right? It's something that in adults, right, a lot of times you can solve with LASIK. In kids, though, you don't want to really do LASIK at a young age because it's going to do permanent corneal damage. So what you really want to do is prevent the disease from happening. So in adults, a lot of times myopia is happening because over time our muscles get weaker, or cornea gets stiffer, as well as our lens actually gets stiffer. The ciliary bodies can't pull on it as much. And so we can't focus light as adults. But in kids, it's actually happening because the eye is growing too long in one direction. And so then the light comes in and is actually focusing not at the fovea, at the retina where it's supposed to. It's focusing in the middle of your eye. And so it just causes this permanent eye damage that then you either have to have lenses, or you're going to have to wait until you're old enough that you could then have LASIK. But in the meantime, you're going to have to wear contacts or glasses, and then you're going to have eye surgery with it, even though a lot of times it's preventable. And so we're really trying to educate the community on, hey, this is a preventable disease in a lot of ways. It's also genetic, so there's a genetic component to it. But there's a great paper that came out this last year that showed each hour of outdoor time reduces your likelihood of myopia by 17%. So if a kid will just spend 3 hours a day outdoors playing around, then they can reduce their likelihood of myopia by 50%. It's
Josh,
dramatic.
Could you tell the audience what inspired you to put your money where your mouth is? And goodness sakes,
Yeah.
and then the team you've put together, the IP lawyer team, your IT guy, your CTO, and the award you just recently accepted for being in the top ocular novel technology. Where did this all start?
Yeah, so when I was a kid, my dad has a genetic eye disorder called keratoconus. So it's a disease where your cornea, instead of being nice and round, it wants to cone outwards. And so growing up, I watched my dad have multiple eye surgeries, and his biggest fear in life was that he was going to go blind. And so that really stuck with me as a kid. And so when I got into college, I studied biomedical engineering. I did a lot of research in ocular biomechanics, and met my co-founders, who one of them was 20 years at Humana doing image processing. The other one was at Alcon. Alcon's one of the largest pharmaceutical companies here in Southern California. And we connected, and we were like, okay, let's start going to these conferences. Let's see what innovation is happening. And we would go to these medical device conferences, and there was no innovation. It was the same lens on the same, Goldman tonometer. Oh, this one, is slightly better. It's 1% more accurate than the year before. And yes, of course, it's now 12,000 instead of 10,000. And we were just frustrated. Every year we would go to these things, and so frustrated at the lack of innovation. Mm-hmm. And so we met doctors from, like, the head of our medical advisory board is the chair of ophthalmology at Mayo. And we met a lot of doctors from Baylor,
pretty good,
and
right?
Western. Yeah, pretty good. Just one of the top guys.
Yeah.
And
how'd you get that? Yeah, that's amazing. How'd you do that?
So we actually connected with him because it's Dr. Arthur Sid at Mayo, and he's also interested in ocular biomechanics and kind of tired of the lack of innovation in the area. And so at the time, back in 2015, 2016, there wasn't very many people looking at ocular biomechanics. We were some of the only people that would go to those posters. That there was like 5 or 6 posters on ocular biomechanics. So all the people that are interested are standing in the same area. And so you just get to talking. And he's a wonderful doctor, has a degree in mechanical engineering as well. So he got it. He got like, oh, yeah, the eye, you can't think of it as some static, never changing product. No, it is constantly moving, constantly changing. And so we need to treat it in that way. We can't just treat it as a single snapshot in time. I share this all the time. It would be similar to if you had a diabetic patient and you said, we're only going to read your glucose levels once a year, and then we're going to treat you based on that one measurement. Right. Everyone would think that you were insane. Like, why would you do that? You know that it's going to change. And yet we still do that with ocular diseases. We say, well, just one measurement, whatever, it'll be fine.
That's what we discovered
this morning. Doctors know.
Yeah.
Right. And doctors know that that's not enough, but they don't have a way to collect more data. So we built our company. Recently, we were awarded at iCelerator. So the American Academy of Ophthalmology puts on an event called iCelerator. And there's 42 different companies that were there, some public companies that were there. And we won Best of iCelerator. And so we were very excited about that. About 1,000 optometrists and ophthalmologists that were there in the audience.
Goodness.
A couple different VC firms. And so we've been working hard. And I mean, we're in the middle of a capital raise right now. And so it's been keeping us busy. But it's always good because the big part, too, is spreading awareness so that doctors know what they can do outside of the office.
And then talk about your FDA submission that is on track, and you have potentially some good news coming up here soon.
Yeah, so we're a Class 2 510K exempt medical device. And so because our frames are classified as a medical device, you have to go through the FDA clearance. And so we've been working for about the last year on our whole, you can see our beautiful frames there.
Pretty cool. And you got a phenomenal 3-minute video on your website, blinkframes.com. Coolest video I've ever seen. I mean, you got the cool factor going on. Like, goodness.
Yeah.
Better stop
so
this.
We're in the middle of our FDA clearance. Middle is in at the end, kind of the last mile of this thing. And so we recently got FCC and IPX, which is IPX is water resistivity, so making sure that people can walk outside in the rain with our frames on, as I did this morning walking in my car. And FCC is to make sure that, we have a lot of electronics in the frames. We want to make sure that it's not impacting the human in any way. Making sure our levels of radiation are so minimal that they would never do any harm to the patient. And so,
and they're super light. They're
incredibly light.
What kind of plastic is that? That's
here.
Yeah, so we use nylon for everything.
Nylon,
very lightweight material.
The cameras are inside.
Cameras are inside. If you can see the little notches there, kind of at or 9 o'clock, 3 o'clock of the eye.
Mm-hmm.
And we're about half the weight of Ray-Ban frames, the Ray-Ban stories. And yet we have a 16-hour battery life. So our frames last all day long. It's not like you have to take them off after a couple hours and charge them and then flip to your actual pair of glasses. I wear mine every single day. I've worn them for over a year now. They're great. And then we put any prescription in you want. So I have a very light prescription. One of my co-founders has Coke bottle lenses on there. He's got some thick lenses. But then if you don't wear, glasses normally, or you like wearing contacts, but you still want to monitor your ocular health, you just put blue light lenses in or readers, and then you can have those for when you're on your computer and you're going around your daily life.
How close are you for your capital raise?
Yeah, so we're about halfway through right now. And so we're working with a couple of VC funds we're in due diligence with right now. And so we're raising $2 million right now in a convertible note.
And your valuation is really low right now. And I know you're going to accelerate that as soon as you get, FDA and...
Yeah, we think it's a pretty good deal, mainly because we want the right investor, right? We don't, we're not crazy.
It's for accredited investors only.
Of course, accredited investors, wanting people that really see the benefit of what we can bring to society and really wanting to partner with us, not just for the great payoff one day, which is of course going to come, but really for understanding what this tech can bring to society in helping kids and helping adults preserve their vision, live a better life, and, just monitor their eye health and general wellness outside of the office.
So when I first met you, you had a great technology, novel. It works. You have a great team, because when I'm looking to help decide if I'm going to help client raise capital or recommend it to an accredited investor, I look at the technology, and then you look at the team and the experience. And of course, you have a world-class team as well. You talk about that real quick, because the risk is, okay, this will get out there, but then the team won't execute. That I get that a lot of feedback from clients, and even some folks that we met over the weekend. A doctor and his wife. He's, well, we invested hundreds of thousands of dollars on what we thought were just no-brainer technologies, but it was the execution, and then ended up, the partners kept suing each other, and we were like, oh, goodness sake. So tell the audience why you're confident about this and your team.
Yeah, so I feel incredibly blessed to have, a team like we do around me. They're really the stars of the show. So like I said before, my two co-founders, one was at Humana for 20 years doing image processing, computer vision. And so he really heads up our technology side. He's our CTO, Dr. Creed Jones, so PhD in computer science. And then also my other co-founder, PhD in mechanical engineering, was at Alcon, was at Raytheon, really good into the optics, into understanding, how we can run a medical device through FDA clearance. And so that's been incredibly beneficial. And then last year, we actually brought on our chief medical officer. So he has Dr. Rayhan Ahmed. He's a board certified ophthalmologist, has his MBA from MIT. And we've been incredibly thrilled with him. So he's out of Baylor, and he's still in Texas, and he does a ton of our studies down there in Texas.
You know some Baylor people.
Oh, yeah. Baylor's a great institution.
Yeah. And then because of that, too, we've met some incredible doctors. Dr. Stephen Flugfelder from Baylor. He's probably the top dry eye doctor in the U.S., and as well as Dr. Arthur Sitt, like I said, at Mayo. Their chair of ophthalmology there. He's really into glaucoma. That's his specialty in the ocular biomechanics. And then we have doctors at Western, doctors at UCI, doctors up in UCSF. So we've built a great medical advisory team as well to come around us and to really give us direction on what industry is looking for and how we can play our part in progressing industry kind of to the next level. So that's kind of the gist of our team.
And the advice was to go towards the pediatric market first.
Yeah.
I know you were here in Scottsdale for a truckers conference a few weeks back as well, and that might be an option. But and then you got international. Of course, you're going to need a phenomenal salesperson, right, to get that team put together, execute that.
Yeah. And so we have a couple of different pipelines for that. We've partnered with a couple other companies, leveraging their sales force early on, so that we don't have to bring in our own full sales force. It gets expensive as a startup pretty quickly, and so we try to keep our costs real low, stay as lean and as agile as possible. So we prefer partnerships early on, which is also part of the reason why we're raising this round, so that we can find investors that have those strategic partnerships that we can help leverage and really grow the business.
And you got a big endorsement by the federal government as well, with a huge grant that was tremendous too.
So I forgot to say, so we, from 2019 basically to 2021, we're fully funded through the National Science Foundation. So the National Science Foundation to date has put in around 1.85 in $1.85 million non-diluting funds into the company.
Yeah.
And so phase 1, phase 2, phase 2B, and they've been great for us. We're now looking at some DoD stuff, some stuff for the Army, stuff for the Air Force, mainly because our product is really lightweight, really portable, easy to use.
Joshua, how about pickleball? You got a sports frame coming out?
Yeah, exactly.
Because we need to play this better. Okay, could that make our dinks better?
Honestly,
Make your
blinks,
dink and a blink.
Blink and a dink.
Yeah. Yeah, we can. So the thing that we look at is fatigue, right? And that's a big one for pickleball, right? If you're not focused, if you're tired, if you didn't sleep well enough the night before, you're not going to spot that ball soon enough.
Okay, there's your market. There's your market.
So let's talk about competition, because when you look at, a company with novel technology and you look at the positioning, your go-to-market, you look at your competition, who is that?
Yeah, so the way I describe it a lot of times is we don't necessarily have competition as a platform. We have competition with individual diseases. So it'd be the same if we, again, go back to the analogy of the diabetic industry. The difference between the test strips and the CGMs, the continuous glucose monitoring, right? That's kind of the difference that we see ourselves at. There's some companies in the ocular space that are disease specific, right? That are like, hey, here's an at-home device for this one disease, and we're relying on the patient to use it as often as we can force them to.
I see.
That as much as the doctor can push the patient, hey, use that device, use that device, use that device, and they find that they'll probably use it once every other day. So you get definitely more data than you would from a doctor's visit. But the difference is we say, well, that still isn't enough for us. And so we go and say, let's do it continuously. Don't rely on the patient to have to take a test every so often, because they'll forget. They'll throw it in their bottom drawer of their nightstand. And 6 months later, a week before they go to the doctor's office, they'll be like, oh, I got to use this thing. Right. And so for us, we say, that's crazy. That puts way too much of a burden on the user. And remembering that a lot of eye diseases are either pediatric or elderly. And so it's two populations that you really don't want to put a burden on for relying on them to do the testing. And so for us, we say, well, we're just going to say, wear your frames, right? Just wear them. You put them on the charger. We have these great little chargers that you put on your nightstand. They magnetically clip on. You clip onto the charger at night. They automatically find your Wi-Fi, encrypt all of the data, stream it off to our servers. In the morning, you just have a pair of frames. You take them off, you put them on. I wear them all day. I forget that I'm wearing smart frames. And that's the point.
Right.
Is we want our patients to really just feel like it's a part of their daily life so that they collect more data.
And is that data then shared back to the patient, the user, right? It gets sent in a PDF?
No, so we have an app on the App Store that we released in November, Android and iOS. And so you connect to your frames, you authenticate them to your account, and then every night when all your data is streamed off, it then updates all of your information on your app. You can see all of it. The doctor, if you can share with any doctor, any family member that you want to, the user is in control of their data. So if they want to share it with their doctor, great. If you're worried about sharing it with your doctor and you just want to show them your phone when you come into the office and show them your 6 months of data, awesome. All more power to you. Right. But then you can share it with family members. If it's a pediatric frame, the parents can see all of the data.
Rick's got to share it with me because I need him around.
Yeah.
So
exactly.
These will be on his pretty soon. With your prescription.
So
and that's kind of the point especially in the elderly community, Dr. Jacoby. Not that you're elderly, you got many years before
not
that.
even close. Not even close.
Yeah. A lot of times, it's the children that are worried about their parents' eyesight. They don't want. You don't want grandma to lose her vision so much that she can't drive anymore, right? And that's kind of the issue, is that if they're not taking their medication, if they're not on top of their eye health, if they're
consuming too much sugar.
Right. Or if they're consuming too much sugar.
Yeah.
And so this is a way for, kids, grandkids to help also monitor their eye health and say, hey, I don't think you've taken your eye drops in the last week. What's going on? Your pressure is through the roof.
Yeah.
Oh, I forgot to fill it, blah, 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 blah. But the whole point is building an ecosystem around their health so that everyone is on the same page, so they're all benefiting it.
Like, I mean, when I first introduced it to Rick, or when he met you there in Newport Beach, he's like, "This is amazing."
Right.
Yeah.
So this is just another example of a nerve, basically, in a muscle, eye, that it's being affected by not only biomechanics, but also by biochemistry and our diet. And you can measure this in real time.
Yep.
Like that patient or fellow we were talking to this morning.
Right.
I go to my ophthalmologist once a year. Well, this is data that's collected in real time. So,
And
Josh,
by the way, he's talking to you tomorrow after 2. Tomorrow is Friday, so we'll get that on the books.
So, Josh, tell us the time frame. When should we check back with you? Like in 3 months, and FDA will be under your belt.
Well, we'll see him.
yeah.
We'll see him in March in Newport Beach for another investor
That's right.
conference. So
Yeah.
he'll be there.
Yeah, we can absolutely do another interview then. We should have FDA approval here almost any week.
Yeah.
You know, we're
That's
finishing up
exciting.
our validation study. Yeah, it's a huge deal. I mean, as a startup company, one of those things that's, you know, FDA clearance just seems like this mammoth. But we've done a great job at working through it and figuring it out, and we're going to be happy when we're on the other side of it for sure.
Hats off to your team.
It's been a process.
Yeah.
but
Well, I can't wait to get it out to my audience with Sugar Crush, and you certainly are the rest of the story on diabetics.
Well, you also mentioned blink frames in your book, right?
Oh yeah, blink frame is an essential part of getting unglued, because without the data, how do you go about fixing the problem? So I can't wait to hear your next report, and maybe it's Newport Beach
Yeah, March
in March.
with
Josh, this-
MedTech conference. You
Wow,
bet.
this
Yeah.
has been great. You'll keep us tuned up here, and think about that pickleball.
absolutely.
Yeah,
I really appreciate
you
it.
want like red ones, the cool red
I think
ones,
so. Red ones,
like
safety glass,
racing red.
racing red. Yeah.
Oh.
yeah. Maybe a little visor. I don't know. We got a
Little blink visor?
Yeah, blink visor. What do you think?
We'll figure something
And
out.
an
I'm sure.
accessory to the.
Yeah.
All right.
Well, fantastic. Thank you for being on the show, Josh. I'm just thrilled to be part of the team here. Rick is as well, and we're just grateful for you and the team, what you've done, what you've done, and what you're going to do for humanity. You're really changing and providing just a great tool to diagnose and prevent, degenerative issues. Right?
Right.
Yeah.
Yeah. I really appreciate it, Dan, Dr. Jacoby. It's always great to talk.
And so how do people get a hold of you, Josh? Let's for the audience. We'll put it in the notes in our podcast, but blinkframes.com.
Blinkframes.com. We have a Let's Stay Connected button there, or you can send an email to info@blinkframes.com.
Okay.
And connect.
And then you get that and just, or they can contact me through Dan at capitalfit.us, of course, and we'll point in the right direction. If they have any interest in further discussion with you about the investment opportunity, I'll send them to you. And Rick, have any parting
I
advice
just
or
wish
words?
you all the luck in the world. A shout out to your technology to the world, and I'll do my best in my new book, Unglued, which should be out any week now. So, yes, don't send us any more rain from Riverside. We're kind of gray over here.
I love this. We need it.
Well,
Well, you take care, Josh. I mean, he has to worry about the waves, right?
that's right. The waves.
Oh, yeah.
Jeez.
Don't go near the shore. No surfing for you.
The waves and the earthquakes, they all get you.
All right.
Well, I'm sure we'll see you soon, Josh, and thanks for being on the show. And we'll keep moving things forward in the right direction for the company, Blink Frames.
Thank you.
Appreciate it.
All right,
Take care.
you bet. Okay, bye.